Now move towards LVOT. It is a non-axial view. How can we make this view? We can make this view by rotating our transducer from 4 chamber at 45-degree clockwise rotation. The LVOT track will be clear or obvious on the screen. It shows the aortoseptal and aortomitral continuity in normally, and if there is any kind of stenosis, it is a sign of early intervention. It is also very useful in order to see the relationship of great arteries in DTGA or LTGA or DORV for the sake of diagnosis.
And this is the LVOT track. This is LVOT 5 chamber view committed to the LV. There is on the color Doppler we can see no turbulence across, no stenosis, no regurgitation as well, and septum is also intact here.
We move toward RVOT. It is non-axial view. We can make this view by moving the transducer from 4 chamber view at 90-degree clockwise rotation. We get the RVOT very clear. RVOT point posteriorly to the spine. It is mid-sagittal view. It continues as ductus arteriosus having axial bifurcation like LVOT. RVOT is also very important to see the greater arteries relationship in order to look for the great artery transposition, TGA, DTGA, or the DORV setting. Are also PS critical PS is also a early indication of the intervention like that of the aortic stenosis.
The pulmonary artery coming out of the RV, laminar flow in the pulmonary artery going, showing no turbulence and no stenosis as well.
We can make the triple vessel view and triple vessel tracheal view from 4 chamber view by moving the probe or translatory shift and reach supramediastinum. Thymus is there to separate the great arteries from the sternum. The color should be the same in both great arteries, which is a normal pattern, and the V figure, which is shown in the downward picture, we can image through the aorta and the ductal arch and aortic arch most left of the trachea and left of the spine. So this arrangement of the great arteries are according to their size as PA, aorta, SVC, and trachea. This view is also said to be the past view. P stand for pulmonary artery, A stand for aorta, S stand for SVC, and T for trachea.
Here on the screen we can see the triple vessel view. This is pulmonary artery, this is aorta, this is SVC, and this is trachea. You can see on the screen very clearly. Now on the color flow you can see aorta and the pulmonary artery having the same color. Pulmonary artery and aorta having the same color. This also shows that there is no abnormality.
Aortic arch and ductal arch are can be seen from the sagittal view. Ascending aorta then give rise into the descending aorta having its branches. Pulmonary artery give rise to the ductal arch and its branches.
About the aortic descending aorta. This is descending aorta through and through you can see easily, and these are the branches of the descending aorta. You can easily and clearly see. The next one is the ductal arch view. This is the pulmonary artery. This give rise to the ductal arch. Here we can see is clearly this is the ductal arch. So these are all the views we have seen in this today's echo normal echo study.
You, inshallah, I will come in my next session with more information. Thank you. Allah Hafiz.